Okay, so I am going to be administering a blood transfusion. So first, I'm going to introduce myself to the patient and explain what I am about to do, and then I will get their consent for the procedure, and I'll witness them signing the document. So I'm going to have my patient Caitlin here sign this consent form, and date it. Okay, so I witnessed that, and now I'm going to provide education on the symptoms of what the symptoms of a transfusion reaction would be, which includes dizziness, chills, fever, back pain, a rash, and then I will check my provider orders to see how much red blood cells needs to be infused and how much normal saline to be infused with it. And then I'm also going to get a good baseline vital sign assessment on my patient before starting too, so that I can easily identify if something is out of range for their vital signs. Okay, so now I'm going to wash my hands and gather my supplies. So I have my blood, and I'm going to inspect it and make sure there's no fragments or gas bubbles or anything abnormal in the blood. And I'm also going to make sure that it is not expired. And then I'm going to check my normal saline too and make sure it's clear and there's nothing floating and that it is also not expired. So that's good. And I have my tubing here ready. And so now I'm going to go into my patient's room, and I'm going to get my patient's two forms of identification, their name and date of birth, and then I'm going to double check their blood type, and then check the donor's blood type, and then I'm also going to confirm the ID, the unit number on the blood, and then also on my client's ID band that I have right here, and so I can see that matches up just right. And then I'm also going to double check the expiration date again on my blood, and the orders and the need for the blood transfusion. And so now I'm going to have my second nurse, Caitlin, come and verify that I have the right blood and confirm it on my patient's blood ID band, and also on my provider orders.
Okay, it's correct.
Okay.
Yep,
So it's good?
Yep.
Okay. All right, so now I'm going to hang both of my go. Okay, and then I'll set up. Okay. And now I'm going to make sure all of my clamps are off. Okay. Okay. Okay, so I'm going to spike so hard. Oh my goodness. Jeez. Okay. That was unnecessarily hard. Okay. Now I can spike my blood. Okay, so now they're spiked. Now I'm going to prime the saline first. So we'll unclamp it. Let it run through. Fill my drip chamber, at least halfway. Let's go on here. Okay, so then once I have my saline primed and in the drip chamber, then I'm going to clamp it again, because I don't want the blood to go back into my saline bag. So now I'm going to prime my blood tubing. Now I'm going to unclamp this one. And my saline. Okay, so now they're both running together, and all of my tubing is just about primed. Okay, so then now it is ready to be hooked up to my patient, and I want to make sure my patient has a patent IV site, and so I'll do my my third medication check with the provider's orders, make sure I have the right blood type, and make sure I have the right donor blood type and match it with my client's blood type again, and check their blood ID band again, and their unit number. And then once I complete all of my checks, then I will hook it up to my patient, and then I will let it infuse, and I'm going to stay with my patient for the first 15 minutes for sure, and monitor for any transfusion reactions, and I will take their vital signs at 15 minutes, and then take them again at 30 minutes, and I will make sure that this blood doesn't infuse for more than 4 hours, and I'm going to have the rate at 25 to 50 milliliters per hour for the first 15 minutes, because I want it to go in slowly at first to monitor for those reactions. And then I will document the procedure and how much blood I infused and how much saline I infused, and then I'll also document my client's vital signs and their and how they tolerated the procedure and if they had any side effects. And then I will wash my hands.